Then we have epiglottitis, which is swelling or irritation of the cartilage that covers the trachea, the epiglottis, and the windpipe. Usually caused again by bacteria and virus, but most commonly is the virus. And that is the H. influenzae, the S. bichinesis, or the S. pneumoniae, which can mostly cause that. And this is because of the immune response. Exposure to any of those pathogens causes an inflammatory response, which triggers, of course, those inflammatory reactions, which now causes the erythema, which is the reddening, and the edema of the epiglottis. So can manifest with the hoarseness of the voice or dysphonia, or can cause aphonia, which is inability to speak, dry, sore, burning throat, coughing, dysphagia, which is difficulties in swallowing, swollen lymph nodes, dyspnea are some of those manifestations. Again, just like the rest of the upper respiratory tract infections, your diagnosis will be based on the symptoms of the patient and the appearance of the larynx. So you can do an endoscopy, which will help you to directly visualize the vocal cord, or you can do a throat swab where you get a sample from the throat, and then you get to examine that and check if there is presence of bacteria or virus that is going to help you determine the exact viral cause or bacterial cause, and then it will help you to determine the exact management. There can be impaired communication, of course, because of the swelling as a result of an infection. Again, management requires you to rest the voice, avoid irritants like smokes. You need to avoid smoking, active smoking, or passive smoking. You need to avoid that. Inhaling cool steam or aerosols that are going to soothe the airway linings and relieve the irritation. Treat any primary respiratory tract infection, because this glottitis again can be caused by another upper respiratory tract infection. So treat that respiratory infection, you could have managed this. If it's because of gastroesophageal reflux, then proton pump inhibitors, the PPIs, the most common PPI, that's proton pump inhibitor, is omeprazole, just to get to lower the acidity of that gastric content, to limit the corrosion or that inflammation of the linings. Corticosteroids, if the inflammation is severe, which will require you to give a corticosteroid. Yes, yeah, dexamethasone, betamethasone, prednisone, all those are corticosteroid drugs. So the corticosteroids, those are synthetic drugs. They try to mimic the effects of cortisol. So they can be divided into the glucocorticoids and the mineralocorticoids. They basically affect metabolism and inflammation. They try to manage inflammation. So example of drugs are like the dexamethasone, the betamethasone, prednisolone, hydrocortisone. So those son things are corticosteroids, and they suppress inflammation, suppress immune cell activity, and decrease histamine release. So usually they can be given, the corticosteroids can be given in allergic reactions, in autoimmune diseases, in inflammatory diseases, in respiratory diseases, like what we are talking about here. They can always be given. So routes of administration can be given orally, IV, IM, topical, inhalation, nasal sprays, ophthalmic drops. They can be given in so many through various routes. So go and read on that, even as you wait to discuss that in your pharmacology. Your nursing care, rest the voice, humidify the environment, very important. encourage fluid intake. That's when to thin the secretions. You can see this first two nursing management, they are appearing in all the conditions of the upper respiratory infection. I don't know, I will find it very amusing that if I give a question on this, nobody's able to get it right, because the clinical manifestations are the same. The management is the same. Viral origin, you manage with antiviral drugs. Bacterial origin, you manage with antibacterial drugs. Because all of these are inflammatory in nature, you can give corticosteroids. Your nursing management, encourage oral fluid, increase fluid intake to thin the secretions, apply to all of them. The instruct in this one, instruct the patient importance of taking prescribed medications, the proton pump inhibitors, the omeprazole, just to manage the gastric reflux content, the acidity. Um, Complications, mostly there are not many. Patients will always recover from laryngitis.